But I think that there are things that can be done. And let me take the first one here, and that is Howard Dean, former governor of Vermont, I believe, former chairman of the Democratic National Committee, a physician, was just at a town meeting helping one of his fellow Democrats. I'm not sure where it was, but the question was asked by the audience, said, what about medical malpractice reform? What about tort reform? Why isn't that in this proposal? And he said, I think I admire him for his honesty, because he said, you know, to be honest, he said the trial lawyers are too tough to take on. But medical malpractice reform ought to be a part of whatever we do. The other things I think that we do a lot to ourselves. I mean, in terms of creating, I think, problems in the marketplace and increasing costs. I mean, you look at the regulatory framework. Let's take that it's primarily done by states, insurance regulation. But the way it's done is, unless you're a large multi-state employer, you can't buy insurance across state lines. You're limited to buying insurance from folks licensed in the state of Colorado. Well, yeah, that's kind of, in my, that's limiting price competition. In states have layered, in Colorado has layered mandate after mandate after mandate on insurance policies that they regulate. Now I'll give you an example. When I was in the state senate, there was a bill about mental health parity on private health insurance, and now, so that's not the large employer, that's not going to affect them, because they're exempt under federal regulation, they're a multi-state employer. But it's going to affect everybody else, that small business group market. And so the mental health parity, and I got down to the floor to say, to question the sponsor of the bill. And I said, well, if we're mandating this on the private sector, why don't we mandate this on the public sector? Why don't you throw in state employees in your bill? And the sponsor said, well, that would cost too much. And then we'd have to go through the appropriations process because they had a fiscal note because it was the cost of the state, where whatever we did in the private sector, that wasn't calculated in the equation. And so every year, mandate after mandate after mandate, driving costs. So I think we do it to ourselves, and we already have a program to take care of those people that are in the high-risk category. And so, we need to explore all those mandates. Small businesses ought to be able to band together and have the same purchasing power as large corporations do in terms of those discounts. And that can be that within regulatory reform, that certainly can be done. So I think that there are a lot of things that can be done. I'm hoping that we can meet in the middle and get some market-based insurance reforms done, as well as medical malpractice reforms done. And but it is interesting to see when we go back to the Congress what the environment is after. I mean, a lot of folks got the stuffings kicked at them during this August recess, and so it's kind of message they bring back to the Congress after having met with their constituents. But so what I want to do now is, I think there's some folks that signed up to speak, for and against the public option. And let's be respectful, irrespective of how we feel about it or how somebody feels about it, because I think it's important that we learned this is an opportunity to listen tonight.